On Monday last week, a so-called independent panel, the U.S. Preventive Task Force, came out with new recommendations for mammograms, suggesting women start routine mammograms at age 50, not 40, as is the standard now. Now, one of the arguments is mammograms do more harm than good, cause more false positives, and more unnecessary surgery for breast cancer. That sent women across the country reeling, wondering if they should or shouldn't be getting a mammogram and at what age. So 2 days later, Wednesday last week, the White House jumped to clear up some of the confusion and worry and to distance itself from the recommendations of that task force. Health and Human Services Secretary Kathleen Sebelius said Wednesday, quote, "The U.S. Preventive Task Force is an outside, independent panel of doctors and scientists who make recommendations. They do not set federal policy, and they don't determine what services are covered by the federal government." So keeping them honest, we read the Senate bill tonight, and sure enough, that so-called outside and independent panel has its hands right in that bill. In fact, the Senate bill relies on that task force's recommendations to outline what preventive benefits Americans should have access to. That's right, the same task force whose influence the White House is playing down is actually weighing in on whether or not your mammogram should be covered. Take a look right there in section 2713. It's titled Coverage of Preventive Health Services. It reads, quote, "A group health plan and a health insurance issuer shall provide coverage for and shall not impose any cost-sharing requirements for services that have in effect a priority rating of A or B in the current recommendations of the U.S. Preventive Services Task Force." Well, that task force says mammograms between ages 40 and 50 is a level C, not a priority level, not covered. And here's something else. On the Health and Human Services website, the U.S. Preventive Services Task Force is described as the, quote, gold standard for clinic preventive services. And insurance companies look to that panel for guidance on which preventive care practices they should actually cover. But now you suddenly have the administration distancing itself from this task force, which was assembled by Kathleen Sebelius' own department, and saying, in effect, hang on, don't pay any attention to those people. We're not going to listen to their recommendations. Kathleen Sebelius told CNN last week, quote, "They do not make policy decisions. They don't make coverage decisions."
And all of this information coming out, of course, has set off the Republicans who see this, and also some other Americans are saying they see it, political or not, as a sign of rationing, Randy.
Right. Some Republicans have said this is the beginning of rationing, that mammograms would be limited, and so would health care for some. Senator Kay Bailey Hutchinson, a Republican from Texas, said that this will give government an excuse not to provide payments for frequent screenings. Still, the White House insists that these are just recommendations and will not be used to deny treatment or even to make coverage decisions.